Hi, my name is Jasmine Howard. I'm currently getting my undergraduate degree in public health at UNC Greensboro. I chose to do my internship at the Angelou Center for Health Equity because of their goals of achieving health equity, as well as a focus on the underrepresented minority groups.
Hi, my name is Grant Rogers. I am the Health Communications and Marketing Intern at the Angelou Center for Health Equity. I'm a soon-to-be graduate from Appalachian State, and this has given me the chance to finish up my 6-hour credit capstone.
My name is Jonathan Bell, and I actually currently work at Wake Forest in the School of Medicine within the Public Health Sciences Division and the Social Sciences and Health Policy Department. At the School of Medicine, I currently serve as a research project coordinator, and I serve on a research team that specializes in HIV and STD prevention here in the South.
My name is Isaiah Randall, and I'm an associate project manager within the CTSI on the interdisciplinary research team. I graduated from the University of North Carolina at Greensboro with a Bachelor's of Arts in Communications, a Bachelor's of Science in Public Health Education. I served as a health communication intern spring of 2018.
During my internship here as the research intern, I've done some work in data entry as well as data analysis. I've also done recruitment into clinical research. Within the data analysis and entry realm, I've done some work within the MedCat program, which has had me do some pipeline work with high school students to enter them into biomedical and science careers. As far as the recruitment realm, I've done some work as far as recruiting African Americans into Alzheimer's research and evaluating what reasons they choose to and not to participate in clinical research.
I also got the chance to really become a social media expert, you could say, in disseminating health equity topics through our media channels and addressing these health equity topics to our broad social media audience.
So I worked on a few different projects while I served at the Angelou Center. My main project was formulating a white paper about how social media can be used to help further eliminate health disparities and using it as a health communication tool. I also was able to help with the community needs assessment with the North Carolina American Indian tribes, assessing or gathering qualitative data to sort of assess the needs that are facing our tribal communities. And I also was able to work with the Office of Minority Health and Health Disparities in creating health disparity infographics for the North Carolina American Indian tribal communities.
While I was an intern, I assisted my preceptor in the facilitation of focus groups for the health guide for African American women, as well as developing a health equity education video series.
I got the chance to really step outside of my comfort zone, moving from Boone, North Carolina up the road here to Winston-Salem. And in doing so, I transitioned from a college to full-time working schedule, which really put me in a place to mentally prepare that this is what I'm going to be doing career-wise here in the future.
I have worked a full-time job in the evenings once I leave my internship. The MACHE has graciously offered endowments, but I can only imagine that having a fully funded internship program would advantage any future intern to have them fully dedicated and committed to the internship.
While I was an intern, I worked a full-time job in addition to doing 40 hours within my internship and trying to balance my school workload as well. I was working 7 days a week, interning from 8 to 5, and then working from 6 to 11 or 6 to 12.
Having the financial stipend from the Angelou Center did help, as I was at the time applying for graduate school and really needed that income while I didn't have the opportunity to have a second job. Having that stipend really helped me to be able to apply for graduate school and to continue to pursue my professional desires and goals.
Health equity, in helping these populations, I see it too much is they're not given proper resources, and I believe the center gives them the resources to try to get on the same platform that in a lot of ways that they're left behind wise. And we see it far too often that they're either behind in receiving quality care and knowing about quality care, and if they live in rural regions, commuting and getting to these areas where they can receive quality care. And I believe that the center kind of bridges a gap between that for them so that they can get the care they need and pursue a healthy lifestyle and have better healthcare outcomes.
Working here at the MACHE not only teaches me the current disparities that we're dealing with, it's also granted me opportunities to go out into the community and act on these disparities and hopefully achieve the goal of health equity.
I think I learned that health equity is something that is a very universal challenge. I think especially when I was an undergrad, I viewed health equity as only a problem that was facing very global regions that are not in our backyard. So recognizing that here in Winston-Salem, in the triad where I grew up, that there is a desperate need for health equity. It's not just outside of the United States, or it's not just in areas that I've never been to. It's actually in my own backyard.
One of the main things that I learned about health equity is the root causes of health equity, specifically the institution's role in some health inequities throughout the Winston-Salem community, and then also learning about ways that we can be advocates for our community and work to knock some of those barriers down to provide more equitable services and to be of service to the community.
This internship has taught me a lot, the first of which would be time management and diversifying myself as an inspiring young professional. I'm really happy I got to collaborate and communicate with some really intelligent people here at the center and network with people at the Baptist Medical Center. This isn't something that a lot of kids my age get the chance to do, and I'm really fortunate that I was given that chance and the ability to kind of grow up and show these people what I know and what I can bring to the table. Ultimately, I think it really gave me the tools to be an efficient employee as to pursue sales and the confidence to pursue my goals upon exiting this internship.
Being here at the Maya Angelou Center for Health Equity has affected my view of health equity by showing me that it's more to it than just the simple term.
But also working at the Maya Angelou Center, it gave me amazing opportunities both to network with faculty and staff at Wake Forest, as well as to learn sort of from the mouths of professionals here at the institution. I honestly don't think I would have the job that I currently have if it wasn't for working at the Maya Angelou Center. And I consider it a great opportunity, and I consider myself to be very fortunate to have gotten an internship at one of the state's best schools of medicine and being able to really jumpstart my career in a way that I wouldn't have ever pictured or fathomed, really.
I would definitely say Maya Angelou Center has definitely been a blessing in my life. I wouldn't be where I am today if it was not for the team that's given me the opportunity to be an intern. I've never thought, I've always dreamed of, working and finding a job after college and being able to foster professional relationships, but I've never thought it would actually come so quickly and that things would actually follow through and happen for me. But it's just really been a blessing to be here and to have them, and the Maya Angelou Center always have a special place in my heart.